Welcome back to Upfront. President Trump's doctor says the president has completed his course of therapy for COVID-19. He says the president is stable and doesn't show signs of progression of illness. He says Trump can return to public engagements as soon as this weekend. I talked to the Medicare and Medicaid Administrator, Seema Verma, who's also on the White House Coronavirus Task Force, about the COVID situation here in Wisconsin and at the White House. The latest coronavirus task force report out this past week classifies Wisconsin as in the red zone. Bluntly says Wisconsin will see further increases in hospitalizations and deaths. Curious from your perspective on the task force, how concerned are you with Wisconsin's trajectory with COVID-19?
Well, we're always very concerned when we see a high positivity rate, and we're seeing spread across the state, not just in college towns. So we are concerned. And when you start to see the number of cases go up, there's always the potential for increased hospitalization. So we're really concerned. We want to make sure that people understand how they can do their part to mitigate the spread of the virus. So, you know, you've heard the 3 W's: watch your distance, wear a mask, wash your hands. And, you know, those are really the important steps that we can all take to try to mitigate the spread of the virus.
Especially in the northeast part of the region, Green Bay, Appleton, Oshkosh, they're ranked 3 of the top 5 metro areas in the country for the number of cases per population. Why do you think that is?
Well, there's a lot of different reasons, you know, why the virus can spread. That being said, I think it's just important to try to focus on what we can do to prevent the further spread. You know, really being mindful of those simple public health recommendations is critical. You know, that being said, I do think that the country is in a different place in terms of our response to the coronavirus. You know, there's supplies are there for those providers on the front lines. We've provided more appropriate, you know, there's more testing that's going on. So, you know, we're here to support the people of Wisconsin with whatever we can do to try to help them at this difficult time and to help them take the steps to mitigate the spread.
In states you are classifying like Wisconsin as red zone, should masks be required to wear?
You know, we leave that decision to the state and local level. That being said, you know, masks are a very important part of the overall strategy. We know that the virus can be spread through respiratory droplets. You know, the analogy I like to give to my kids is, you know, on a cold day when you're talking, you can see your breath. So, you know, your breath has droplets. So even in a simple conversation, you know, you could have the potential to be impacted. So wearing a mask protects you, and it also protects the other person as well.
We're hearing the president may be back on the campaign trail in the next several days. Is that advisable from your position on the task force?
Well, the president's going to be advised by the professional public health and his doctors as well. That being said, you know, the president is the essential worker. And so he's a hardworking man and doing everything he can on behalf of the American people.
After the president returned to the White House this week, Twitter flagged a tweet by him where he said COVID in most populations is far less lethal than the flu. Is that true?
I think the important thing to remember about the COVID virus is that we are making significant strides. You know, when this pandemic hit the country, we were seeing mortality rates, especially in our over 70 population, 1 in 3, 1 in 4. But this is a real testament to the American healthcare delivery system. Our doctors and nurses and those on the front lines, combined with the innovation of our pharmaceutical manufacturers, have come up with new treatments and new ways of managing this virus. And we've seen that mortality rate decline significantly. The best way to prevent mortality, though, is to prevent the spread of the virus and getting it in the first place. But that being said, the new treatments that we're hearing about, remdesivir, all of those things are really having an impact, and we're seeing better outcomes for people that are impacted. How
quickly will those be available to the broad general public?
Well, the treatments that, you know, remdesivir is already available, and some of the other medications that the president used are already available. The FDA continues to be focused on making sure that they're making decisions that are scientifically sound and that the approvals of the drugs are safe and effective. So they're working as quickly as possible, but we're not going to sacrifice science or cut any corners when it comes to the safety of the American people.
A memo out by FEMA this past week on Wednesday, obtained by ABC News, showed at least 34 White House staffers and others who have contracted the virus. That was as of Wednesday. Would you advise businesses and schools in places like Wisconsin to follow the White House response in what they've done with their outbreak?
I think that, anybody who's impacted by an outbreak needs to work with their local health professionals about taking the right steps. At the end of the day, it all comes back to those basic recommendations: wash your hands, wear a mask, and try to be socially distant. I think if we can all do that, we can try to mitigate the spread of this virus.
Seema Verma, Administrator for the Centers for Medicare and Medicaid Services, also member of the White House Coronavirus Task Force. Thank you so much for your expertise and time.
Thank you. Thanks for having me.
Next, how the legislature has performed during COVID.